Cardiff and Vale University Health Board is one of the largest NHS organisations in Wales, employing over 14,000 staff and providing health services to a population of around 470,000 people living in Cardiff and the Vale of Glamorgan. The Health Board incorporates the role of specialist nurse for safeguarding children and young people, offering direct support to children and their families, staff and partner agencies. We interviewed specialist nurses Nikki Harvey and Bev Evans and Children's Services Manager Kwesi Hazel, asking them to describe their roles and how they work together, ensuring children are safeguarded and their best interests addressed within the multi-agency context.
The purpose of my role really is to advise and support staff who are dealing with any child protection issues or any safeguarding concerns. We also have a training role and a supervision role, so we supervise any staff who come into contact with any safeguarding issues. We don't just work with staff who work in children's areas, but any staff at all throughout the OHB, so it doesn't matter whether they work with adults or children, then we would offer that advice to them. A big part of the role is to empower staff so that we don't take on running with the cases ourselves, but try to get the staff involved and for them to follow the process and run with the cases, but we're there throughout that process to help and advise whenever we're needed.
I think that the important thing about the process is that at certain points in the process there are people who own major decisions. For example, it's the local authority who would make the legal applications to protect the child. I know the hospitals can do that, but invariably in safeguarding situation, it is the local authority which is expected to take legal action and to physically care for the child. But everybody understands who and at what point who's responsible for the major decisions.
It's taken quite some time really to build up the relationships that we have with other agencies and also with staff within our own agency sometimes, because it's about getting people to understand what our role is and what the role of the safeguarding team is, but also about us understanding what other roles are as well and taking the time to take on board the challenges that other agencies have, and likewise that they sort of take on board the challenges that we have sometimes.
We work within the All Wales Child Protection Procedures, and obviously part of that is that everybody's responsible for their referral. However, when you work in a busy emergency unit, you may have staff that work 12-hour shifts, but then may not be in for another 2 or 3 days. We have a copy of the referral. We will phone Children's Services and follow it up on their behalf. It's also the staff's responsibility to then come to us to get the feedback from their referral.
One of the main challenges that we had was supervision of parents or carers for those children where there have been concerns. If a child comes into us, then obviously we still need parental consent for some of the investigations that need to be carried out. Children will still need to have somebody they know with them. What we do is put safeguards in place whilst they're here. So we would make sure that doors were kept open, the curtains were kept open. That would be explained to parents that this would be what we would expect, so that they can be observed and we can safeguard the children in that way. There have been issues with partner agencies where they haven't felt that perhaps that is the best course of action at that point, because we're not clear about how an injury perhaps has occurred. But we've worked closely with other agencies, and at the moment we're currently in the process of developing an LSCB protocol, a supervision protocol, so that everybody who's involved with these cases will know what's expected of the agencies involved, but also of the carers whilst they're staying with us.
Some of the challenges that we face is usually about what should happen to a child in hospital who is not deemed to be needing any medical attention. And sometimes there are time limits where children need to move on, but the local authority may not necessarily have an appropriate placement for this child. So that's one of the challenges that we have to constantly deal with and resolve. And I do say we do resolve them. There are situations where a child had to be discharged on a Friday afternoon after a strategy meeting, and that was not possible from social services point of view. The hospital were able to agree to the child remaining on the ward, as well as social workers would be prepared to offer the parents some contact during the weekends. So that was one of those kind of challenges that we both work hard to overcome.
Sometimes there are slight differences with what we would like to happen or with the response that we would like, but then I think because we've got good channels of communication, we can discuss those issues. If there are problems that we don't seem to be able to resolve ourselves, then we can take those to our senior, so it would be to our named nurse for child protection. And there is a regular meeting that's held with senior people in the agencies where if there is something that we're unhappy with or that other agencies are unhappy with, that perhaps the decisions that we've made, that those things can be brought to those meetings and discussed and hopefully resolved.
We regularly speak with children's services. Most days we're on the telephone to them because we're discussing the referrals that have gone in overnight. If we've got children in our care here, we will update them every morning, and we keep up to date throughout the day. As we do investigations, if more concerning features or more concerning findings from those investigations become evident, we will phone children's services and keep them updated. Obviously, sometimes the other considerations, there may be other children in the home as well that we need to consider. And so it's a constant risk assessment whilst the child remains in our care, and that is done with our multi-agency partners. I think things work so well, and I think it's purely down to communication. You know, we keep our communication channels open. If there's an issue, we will resolve it very quickly. There's a professional respect for each agency and individuals within the agency, but we're all open to challenge, and we will accept challenge from each other, and we will discuss it between ourselves and hopefully make some sort of resolution. But the key to this is communication.